article that came out on Pain News Network September 29th, 2017. Fake fentanyl pills found in 40 states. Counterfeit painkillers and other prescription drugs made with illicit fentanyl have killed Americans in at least 16 states, according to a new report that found the fake and highly dangerous drugs have spread from coast to coast. We have documented the spread of counterfeit pills made with illegal fentanyl throughout 40 states. There is documentation that counterfeits made with fentanyl have killed Americans in at least 16 of those states. The other 24 states probably have deaths attributed to the counterfeits made with fentanyl, but because of limited awareness of the problem, those deaths may not have been investigated for counterfeit drugs, said the report by the Partnership for Safe Medicines, PSM, a coalition of pharmacy groups and other healthcare organizations. The report is based on a review of court records, statements by law enforcement, and public health agencies, and news reports. And if you look at this map, what it's showing you in the burgundy color are the states where they found the counterfeit drugs across the country. And you can see it is a lot of states, including the state I'm in, New Jersey. And the brown indicates the actual deaths that occurred from the counterfeit drugs. And you can see that spread all over the map. In the gray area are states they have not found the counterfeit drugs in so far, and it's about 9 states altogether. Okay. Many addicts look for a high, or pain sufferers looking for relief have no idea what they're buying. Experts say a single dose of fentanyl as small as 2 or 3 milligrams can be fatal. Up until now, it's been difficult to grasp the scope and pervasiveness of the counterfeit drug problem, said Dr. Marvin Shepard, chairman of the PSM board and former director for the Center for Pharmacoeconomic Studies at the University of Texas at Austin College of Pharmacy. We've had a number of examples of counterfeit pills, seizures, and tragic fentanyl-related deaths, but this report paints a picture of a nation under siege from fake and lethal drugs coming across our borders. Massachusetts, Pennsylvania, New Jersey, Ohio, and several states now report they have more people dying from overdoses of illicit fentanyl than from prescription opioids. Most of the illicit fentanyl is manufactured in China and smuggled into the United States by drug cartels. In August, the Mexican military found 140 pounds of powdered fentanyl hidden inside a tractor-trailer rig at a checkpoint near Yuma, Arizona. The shipment, which had estimate street value of $1.2 billion, wow, also included nearly 30,000 counterfeit pills made with fentanyl. Okay, now the reason why you see so much fentanyl is because it's so cheap. Apparently it's so cheap, that's why it's being laced in with everything right now, including marijuana. And this picture is showing counterfeit oxycodone pills. Okay, and like they said, a lot of this is coming in from China and then moved across the border into the US. Okay, now we all know about the dark internet, which is used for a lot of drug activity. All right, it's used to be dominated by legal made medications that were stolen and diverted from medicine cabinets, pharmacies, or drug manufacturers. All right, so now a lot of these drugs are counterfeit. People are making copycat drugs, and listen to where these drugs are coming from. I would say 99% of what we're seeing on the streets, bought and sold, is from China, India, Mexico, or from second or third hand distributors. And don't forget about South America. South America still um, distributes a lot of drugs, and those drugs make it across the border. So it's a lot of countries involved in producing this fentanyl that you're seeing hit the American economy. While the DEA and other law enforcement agencies have been warning of fentanyl problems for years, federal health officials have been slow to recognize or even address it, focusing ahead on limiting the use of opioid pain medication. That's only one slice of the pie. I know they're trying to get doctors to write less scripts, but if you don't get rid of the illegal drugs, it's really counterproductive. For example, the Center for Disease Control and Prevention recently launched a new marketing campaign using videos, online advertising, billboards, newspapers, and radio ads to raise awareness about the risk of prescription opioids. The campaign completely ignores the role of fentanyl and heroin in the overdose crisis because the CDC didn't want to risk diluting its primary message. Specifically, is a best practice in communication, and the pharmacy awareness campaign messaging focus on the critical issue of prescription opioids. Given the broad target audience, focusing on prescription opioids avoids diluting the campaign message, the CDC explained. Politicians are also focused on prescription opioids. Several states have adopted or are considering laws that limit opioid prescriptions for acute pain to only a few days' supply, a move that Trump Opioid Commission appears to be considering as a recommendation in its final report. And he's still not talking about signing the National Emergency Declaration, is he? This is a prevention measure to limit the number of drugs that are out there for improper diversion, and to make sure that we don't inadvertently turn people into addicts by giving 30, 60, and 90 pills the first time, said Commission Chairman Governor Chris Christie of New Jersey, whose state was adopted a 5-day limit on new opioid prescriptions. And you saw that map that I showed you in my other video. It's not putting a dent in stopping these drug deaths. So this week, the Pharmaceutical Research and Manufacturers of America, an organization that represents virtually every major drug maker, told the commission that it would support a nationwide 7-day limit on opioid prescriptions for acute pain. All right. I tell you, the problems when it comes down to this drug plague is endless. Endless. Please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. And if you can make a donation to my channel, please do. Peace, family.